This is Michelle Kelly from Los Angeles Rabbit Foundation. I'm here to tell you a few of the reasons why you should spay and neuter your pet rabbits. We have too many rabbits. We can't place all of the rabbits in the United States. We have rabbits in animal shelters and in rescues, and one of the reasons for this is that people are not spaying and neutering their rabbits. You know the saying, rabbits breed like rabbits? Well, a male and female rabbit can conceivably have 200 or 300 rabbits in the course of a year. That's because the female rabbit has a gestation period, or the time from conception to birth of her babies, of 28 to 31 days. She can become pregnant immediately after giving birth and have another litter a month later. At 4 months of age, her babies can reproduce and have more babies. Each litter can be 6 to 9 baby bunnies or kits. So you see the problem. We absolutely have to spay and neuter our rabbits in order to save some of these unwanted rabbits that we can't find homes for now. It's very important. The second reason to spay and neuter your rabbit is health. It's a fact that the majority of female rabbits get reproductive organ cancers by the age of 2. So in order to prevent that, we need to spay the females as soon as possible after the age of 4 months. Some exotic veterinarians will say that the girls should wait till they're 6 months of age, but in some situations it isn't practical to do that. For instance, if you have a rescue, an animal shelter, or if you have a large number of rabbits, what you want to do is keep them together as long as you possibly can without them fighting up until the age of 4 months. You neuter the males at 3 months, and then you spay the females at 4 months, and you track it very carefully. Male rabbits also have health benefits. They have less testicular cancers, they get older, but the primary reason for neutering male rabbits is behavioral. Male rabbits, if not neutered, will often exhibit mating behaviors. They will circle and nip your ankles. They bite, they fight with one another, they spray urine. Who wants bunny urine all over the house, right? So then they can dig and chew and cause damage. And what happens when you have these rabbits with behavioral problems is the people will put them outside, and then they're in danger from predators. So it's much better for the health of the rabbit to neuter them and keep them safe indoors. Then there's happiness. When you neuter a rabbit, you can safely put another neutered rabbit. It's better to have a neutered male and a spayed female. You can introduce them together and they can live together safely and happily. Rabbits really love to have another rabbit. They're herd animals. They really like to live in groups, and they need that 24/7 companionship of their own species. But they can't do that if they're not spayed and neutered. Besides the fact that they'll have too many babies, they'll fight. They don't get along. So it's absolutely essential that you spay and neuter your pet rabbit. It's also important when looking for a pet rabbit to adopt a rabbit from a shelter or a rescue group rather than buy one that's not altered from a pet store. If you have a rabbit, you don't know how old it is, but you're pretty sure it's 3 or 4 months of age, there's some behavioral signs that you can look for that indicate your rabbit is ready to be neutered. The rabbit may make a low humming noise, particularly the male rabbits, and circle your ankles and maybe even nip on them. They may anchor their teeth onto your ankles or wrists and try to, how shall I put it, mate with your fingers. They might try humping on you. They will spray. They might suddenly turn into a teenager where they're being nippy. They don't want to be handled anymore, whereas previously they were easy to handle. And of course, they might fight with other rabbits. These are all indications that your rabbit is probably ready to spay or neuter. And you want to verify that with your rabbit veterinarian first. Okay, it's the night before your rabbit's spay or neuter surgery. And the first thing that you want to be aware of is that rabbits should eat the night before and the morning of the surgery. Unlike cats and dogs, and you may have heard that you fast a cat or dog that they shouldn't eat before surgery, That's not true of rabbits because, first of all, rabbits can't vomit, so there's no risk for them to have food in their system. But in addition to that, more importantly, it's really important that rabbits have food moving through their systems at all times. If a rabbit doesn't have food moving through the digestive system, it will die. So it's really critical to feed your rabbit the night before and the morning of surgery, and also to make sure your rabbit eats after surgery as soon as possible. It's also important to make sure that your rabbit is adequately hydrated. Rabbits drink 5 times the amount of water for their body weight as cats and dogs. They dehydrate very easily, and if they don't drink for a day, it can be fatal. So they always have to have water and they always have to have food. These are important things to realize about a pet rabbit and are true every day when you own a rabbit, not just when they're getting surgery. You want to bring your rabbit to the spay or neuter clinic in a hard carrier, not a cardboard box or a soft carrier, with something absorbable in the bottom like a artificial sheepskin or a towel, so if the rabbit slips, the rabbit won't slip, and if the rabbit has to urinate, it won't get wet. It's really important. And off to surgery. Anytime you're transporting your rabbit, whether it be to surgery or back or to a veterinarian for a visit, you want to make sure that the temperature is stable. Rabbits overheat faster than just about any other companion animal, but post-surgery, their temperature will be dropped. So it's important to keep the temperature not too warm, obviously not over 90 degrees, but you don't want the air conditioner full blast either. You want a temperature-controlled environment for your rabbit on the way home. So you've taken your rabbit home after a spay or neuter surgery. Here are some of the things you want to look for to know that your rabbit is stable and recovering normally. The rabbit should eat within 24 hours. The male should probably eat within 2 or 3 hours post-surgery. It may take the girls a little longer. Sometimes you have to offer them a little of their favorite treat. But anytime a rabbit doesn't eat for 12 hours, you should treat it as a medical emergency. And make sure when you pick your rabbit up that you get the emergency number so that you have a place to go if, say, the night following surgery you have an emergency number to call and a place to go to address any issues post-surgery. Be sure to check the surgical site in the days following your rabbit's spay or neuter. With the female rabbits, you might want to just tip up the front legs and peek under. Make sure that the incision isn't leaking or open or festering. With the male rabbits, because they recover faster, you can actually turn them over and check the surgical site to make sure there's no swelling or inflammation or infection. Problems with males are a lot less common than those with females. You really want to keep an eye on your female rabbit to make sure she's eating. That's really critical. And if she doesn't eat within the first day, you'll need to force feed her. You'll need to syringe feed her a little bit of pellet mush or critical care. And please consult with your veterinarian on how to force feed your rabbit, because it's absolutely critical that your rabbit eat within 24 hours. Please don't forget to take your rabbit in for its post-surgical exam. Most rabbits that have external stitches will need those stitches removed 10 to 14 days post-surgery. But even if your rabbit has internal or dissolvable stitches, you'll still want to bring your bunny in to have a post-neuter exam with your veterinarian. Should your veterinarian advise the use of an Elizabethan collar because your rabbit is chewing or digging at the surgical site post-spay or neuter, please discuss with him or her the possibility of using a belly band around your female rabbit to cover the surgical site so that she cannot reach it, or possibly with the males, a cloth collar around the rabbit instead of a hard plastic cone that would prevent the rabbit from eating. There are some wonderful resources out there to help people who have pet rabbits. Obviously you care about your rabbit or you wouldn't be watching this video. On the internet, you can go to www.rabbit.org. That's the home of the House Rabbit Society. Or you can go to Los Angeles Rabbit Foundation's website, www.labrabbits.org, where you'll find accurate information on rabbit care. There's a lot of misinformation on the internet and in print. You want to make sure that you get proper and accurate information about rabbit care. The best book on pet rabbit care is called The House Rabbit Handbook. It's written by Marinelle Harriman and is published by Drollery Press. You can order the House Rabbit Handbook by going to the House Rabbit Society website, www.rabbit.org.